Want to welcome everyone for being here today. We have an exciting event planned today. As you can see, we have a lot of panelists here and a lot of companies in the healthcare space that are going to be talking about the opportunities that are available for them. For any job seekers or any community partners on the call, we're going to be sharing their contact information, a little bit about what it's like to work there. And because we have so many people here, I think we're going to have a really good event, a lot of good information coming out. So get ready to take some notes. If you have any questions, throw them in the chat, throw them in the Q&A. We'll make sure we get all of our questions answered before the end of the event today. For the panelists that are here, because there are some that we have a few people from the same company. What I'd love to do is if there's one of you that could answer when I ask some questions, that would be great. For any of the attendees, if you have a question for either a specific company or a specific individual, make sure to include that information in your request as well. So what I'd love to do is I'd love to introduce you to our board before we get started. My name is Ryan England. I am the president of NETPA. I'm also the CEO of Core Matters, where we work with growing companies to help them hire better people faster by implementing our proven process, the Core Fit hiring system. Vera Lee is our vice president. Many of you know Vera Lee. She's very active in the community. She is part of the Arizona at Work team, and she's always looking to match community employers with job seekers. Jose is here with us today. He's our treasurer. He's part of the Mercy Care team. He's been very active in the community. He works on connecting with community partners, help supporting them in being able to connect employers to job seekers, and really just helping raise the community up by giving people gainful employment. Cameron is here as well. He is with ZipRecruiter. He is a consulting agency relationship, and he works with community employers. In fact, I think he works with employers all over the country, but a lot here in the Maricopa area, where helping them with managing their advertising spend so they can get in front of active job seekers. And then Maggie probably needs no introduction. She has been involved with NETPA for so long. She is the secretary. She has been over 10 years. She's been a part of this. A wealth of experience in a lot of our community employers, very well connected. If you don't know Maggie, she's definitely someone that you should connect with. Real quick, our core values at NETPA is we want to connect the underserved to the right employers. We believe in and growing our community, and we like doing what's unconventional. For a lot of people on this call today, it's no secret that hiring has gotten very difficult. Whether you're a job seeker or you're an employer, on both sides, it's changed a little bit, and it's a lot more difficult than it has been in the past. So as part of our core values, we really want to help you think outside the box. And that's one of the reasons that we do these employer panels. It's one of the reasons that we promote to our community partners, to really let them know that there are other ways than just going to a job board and crossing your fingers and hoping that your resume gets looked at. There are ways to connect with employers, and we want to be a vehicle for that. So if you're interested in being a part of NETPA, our yearly fees are incredibly low right now. For individuals, it's $25 a year, and for companies and organizations, it's $75. What we use this for is just a way to really say, hey, we're a part of the membership. We really appreciate what we're doing, and we want to be a part of it. So if your organization is not a member of NETPA, but encourage you to become a member. We are talking about doing some member-only events. So if there's any desire for that, please let us know. We bring in guest speakers every other month, and then we do these employer panels as well. So here are the employers we're going to hear from today. I'm really excited to get started. So what I'm going to do, the way this is going to work for anybody that's new, I'm going to ask questions, and I'm going to ask you guys to answer. So for most people on this call, I don't know if Jose prepped you for what we're going to talk about or not. But real easy questions. We're going to start off with the easiest one, probably the one that most of you can answer from memory. What open opportunities do you have right now in your organization? And are there any that are particularly challenging to fill? Whether it's because there's a certain requirement needed, whether it's because the hours aren't quite as desirable, whatever that is, share that with us. just be open and honest with everybody on the call about your positions. What I'd love to do is just call on each one of you, talk about the positions that you have open. For the job seekers on the call, community partners, take some notes, make sure you know how to reach out to. I'm going to ask all of the panelists to put your contact information in the chat. So if you haven't done that yet, let's make it really easy for them to connect with you. Include any website addresses on how people can apply. Or if you're okay with them emailing you or calling you directly, include that as well. All right, so we're going to start with LifeWell. I would love to hear what open positions you have and anything that you're looking to fill right now.
Hey, Ryan.
Hi, everybody. I'm
Alexandra. I'm sorry to interrupt. Just know when you're putting your information in the chat, make sure you reference that you're putting it for all panelists and attendees, because automatically it's checked just for the panelists. So the attendees won't see it. So make sure you're putting all attendees and panelists.
Thank you for that,
Sorry,
Jose.
Alexandra.
Go for it.
Thank you. My name is Alexandra. I'm the Chief HR Officer here at LifeWell. So I oversee the Human Resources Department, all the recruiting and hiring functions. And I have Kara and Jared and Michelle with me today. Each of them are overseeing a different clinical program. We have a lot of open positions, a lot of PhD level positions, behavioral health tech level positions, which includes case managers at our outpatient clinics, clinicians at our residential treatment sites, clinicians at our community living sites, and also clinicians in our outpatient vocational rehab programs as well. So across the board, BHT positions, many different shifts, especially in the residential treatment sites. We have day shifts, we have evening shifts, we have overnight shifts, we have shifts that include weekends, shifts that don't include weekends. So really across the board. And then some higher level positions that we're struggling with right now are definitely counselors, therapists, and you know, there's a higher level of education needed and licensure needed, just as well as medical staff. But that is nothing new. I think there's general issues in the workforce with those kind of higher level type of positions and very specialized positions. Nurse practitioners, psychiatrists, licensed therapists, licensed managers, even to oversee our programs. Yeah, Kara's shaking her head. she's missing a peer in her program, so has been gratefully taking on some additional duties. So yeah, licensed people. But then again, we also have entry-level positions, and not just clinical. We have a call center that we're constantly hiring for. Front office positions that we're constantly hiring for. So really across the board.
Okay, make sure you get any contact information or websites where they can get more information in the chat. A question that did come in, can you describe the requirements for a behavioral health technician?
Yes, of course. So a behavioral health technician is somebody who has either a high school diploma or a GED, plus 3 years of related experience. So it's not necessarily a super entry level position, but also not something where we, necessarily require a degree for, except a high school diploma and a GED. So then if they have that level of education, we would also need 3 years of related experience. If they have a bachelor's degree in a related field like psychology, sociology, social work, anything like that, then they are automatically eligible without any experience.
Okay. All right. Thank you for that.
Mm-hmm.
All right. CPLC, you're up.
Okay, so I'm here representing CPLC and a couple of different programs, and then Amy is here from kind of like a subsidiary of CPLC, Florence Crittenton. So I'll let her explain more after I'm done. But so I am the program director at our clinic in Mesa, and we serve the seriously mentally ill population, adults only. And right now, we're just a standard business hours, so Monday through Friday, 8 through 5. Right now, the SMI clinic is recruiting for many case manager positions, so BHT, CM positions. Basic qualifications is you don't have to have a high school diploma, you just have to have some years of experience in really any related field. It doesn't necessarily have to be in the clinic. If you do have a bachelor's degree, then ones in social services are obviously preferred. We're also hiring for a clinical supervisor who is, so the way CPLC does their clinics is a little bit different than other places. So instead of like a CD or a clinical director, we have a clinical supervisor. And what's unique about their position is that they do supervise the clinical services within the clinic, and they can sign off on things like assessments and treatment plans, but they also spend about 50% of their time providing direct services to our members through counseling. This position is very good for a licensed therapist who needs to acquire hours for their independent license. We do have the ability to supervise those hours. So like I said, this position is really perfect for someone who's already licensed but is looking to work towards their independent license. And then we're also recruiting for 2 SMI registered nurses. So the gist of that is, you know, they help administer medications, mostly by injection or picking up of oral medication, lab draws, PCP coordination, things like that. And then I also want to mention that our Maryvale clinic is general mental health, and they are also recruiting for, I believe, a therapist, so licensed therapist. And then we are also, we're also associated with Corazon, which is CPLC's residential substance abuse program. And they are actively hiring also for a registered nurse, but it's actually a lead position. So lead RN, and then they're also looking for a counselor and intake specialist. And I put our website in the chat. It's pretty simple, cplc.org. I also included my email. So, you know, if you have questions about positions and you don't maybe think that you should apply or aren't sure, feel free to reach out to me and I can answer any questions that you may have.
Awesome. Thank you for that. Amy, I'll let you go since she said you're affiliated.
Yes, thank you. I'm Amy. I'm our director over at Florence Crittenton. Our mission is providing hope and opportunity to all the lives that we touch. So we have a therapeutic group home and a regular group home for girls ages 10 to 18. And we are currently looking for a licensed therapist. That's probably been the hardest one to find within our organization. The hours are 10 a.m. to 6 p.m. so we can support our girls after school hours as well. Our therapeutic group home is really a short-term stay, so it's for youth who are going to be staying with us from 90 to 120 days. And then we have another group home that's in Scottsdale that is more longer-term care, and that's helping pregnant teens, young moms, or individual females who may be coming with a sibling. We are also looking for behavioral health technicians on our morning, afternoon, and overnight shifts. Our morning shifts are 6 a.m. to 2 p.m., our afternoon is 2 p.m. to 10 p.m., and our overnight is 10 p.m. to 6 a.m. And we are also seeking a residential supervisor for our therapeutic group home.
Thank you for that.
In a nutshell.
Yeah, and feel free to throw any of those really difficult positions, links to how they can apply in the chat. We make sure that we get this chat put up on our YouTube channel so that when we do this, they'll have all the links for anybody that watches this after today. So
perfect.
Thank you
so
for
much.
that. All right, Intermountain Centers.
Hi, good morning. My name is Melissa Garcia, and I'm the recruiter here with Intermountain Centers.
I'm Deb Berlin. I'm also in HR, and I'm in charge of leadership and organizational development.
This is our first time joining this panel. Thank you for allowing us to be here. So we are also a behavioral health organization. Our open positions are very similar to what we've already heard. We, as a nonprofit organization, have services all over the state of Arizona. So we're located, our corporate office is located in Tucson, but we do have many offices and locations and services in the Phoenix area. In particular, we do Some of our more difficult to fill positions are going to be ones with, higher qualifications. We do have a nurse opening. We have a psychiatrist opening, as well as a services director opening. But we do also have a number of positions, for instance, a foster care coordinator and some other care coordinator positions that would require similar to a BHT requirement. So as an organization, the minimum age is 21. All incoming employees are required to possess a level 1 fingerprint clearance card, and at minimum have a high school diploma or GED. And typically some of those positions also require a combination of education or previous experience. So for a minimum of a high school diploma or GED, it would be like LifeWell, and a minimum of 3 years of related full-time experience. And then as the education level increases, the required experience decreases. So we do have quite a few care coordinator positions open in the Phoenix area, rehabilitation specialist and peer support specialist openings as well.
Awesome. And if you haven't, make sure to get your information in the chat for us.
Yes.
I'm sensing a trend with behavioral health techs. This is going to be a group. You guys need to get together and go get them together. Anyways, Valleywise. You're muted.
You're muted, Vicki. There we go.
Try that again. I'm Vicki Staples. I'm the Director of Outpatient Behavioral Health. And I have to apologize for my beautiful background here. I'm over at our ACT team today, and we're very excited because we got all new flooring in. And so I'm in the storage area working. So forgive me for the exciting background. But I oversee all of our outpatient behavioral health programs, which include our specialty behavioral health clinics, which are also known as SMI clinics. We call them specialty clinics. We also, just so folks, not to confuse folks, we don't refer to our case managers as case managers. We call them team specialists. So that can be kind of confusing for folks when applying. So if you see a position for team specialists, it has many of the similar functions and roles of a case manager. So within our outpatient specialty clinics, we have an assertive community treatment team in Mesa. We have a first episode center in Avondale for young adults 15 to 25 experiencing their first episode of psychosis. Both of those programs are evidence-based programs. And then we have our Mesa Behavioral Health Specialty Clinic, which has both supportive, connective, and navigator level of care. All of the programs are multidisciplinary teams, similar to what you've heard already, with doctors, psychiatrists, nurses, team specialists, employment rehab specialists, housing specialists, peer support specialists. So we have the whole array of positions. Not all available right now, thank goodness. But we do have some openings, which I'll talk about in just a moment. We also have our integrated behavioral health clinicians that work within our outpatient services. And we have licensed clinicians, and then we have behavioral health specialists who are working on getting their supervision hours to become independently licensed. So very similar. We also provide that clinical supervision to help people move forward with their career and become independently licensed, and then automatically they would promote within our organization to a position once independently licensed. And so those positions are available throughout the Valley. We have 12 FQHCs, or community health centers, which have those clinician positions within the centers. We also, just so folks know, we're a huge hospital-based system. So we have a variety of inpatient. We have 3 inpatient behavioral health programs, and so we're always looking to hire BHTs, nurses, also looking for specialists that really help recreational therapists, a variety of different roles, as you can imagine. And then we have our medical hospitals as well. So we have lots of different positions available, and I put our website on that, and all you need to do is click on careers, and then you can search by what part of town or what type of position, whichever you're interested in. Today, I'm here really to just highlight a couple positions. We have our ACT nurse, who it's a unique position because when you think of nurses, I kind of think of them as community outreach, right? So they're going to be really engaged with a group of individuals that are high need but high benefit, because you really can have an impact in supporting their recovery. You're going to work both in a clinic as well as out in the community and work on a team together. So, and the ACT RN position is a very challenging position, as many of my colleagues on the panel know. I also have ACT team. Any of the ACT team positions, I always say they're hard to fill, and people love working on ACT and really are committed because they do see such an impact in people's lives and in their recovery. But it's not a model for everyone because it's very much community based. And so we have an ACT position for our RN, and we also have a rehab specialist position for our ACT team in Mesa that we're looking to hire right now. And then on our specialty clinics, we have another team specialist position that's available in our Mesa Behavioral Health Specialty Clinic. So those are kind of the 3 outpatient behavioral health. And then in our integrated behavioral health programs, we are hiring a variety of positions for both licensed at the clinical independent level as well as the master's level. So we have a variety of positions available there as well. And then again, on our inpatient side, our FQHC side, and our other specialty programs, we have a variety of positions. We have grant positions, we have administrative, different positions. We have, people who want to focus on HIV specialty services. We have different positions available within our McDowell clinic. So lots of opportunities for folks.
Yeah. Let's make sure we have all links to this in the chat, because I'm sitting here taking notes and I'm like, whoa. So for those people looking right now that are on the call, or if you're watching this on YouTube later and you see these opportunities, make sure to check out the links and go straight and check out these open positions that are out there. So thank you for that, Vicki.
Thank you for the opportunity to come today.
Absolutely. Southwest Network.
Hello. My name is Roxanne Gonzalez. I'm one of the recruiters here for Southwest Network. This is my first time attending, so it's really exciting to meet everyone and to talk about Southwest Network. We have 7 clinics, outpatient clinics throughout Phoenix, so we're only located here in the Phoenix area. And we have children's services and adult services. So our children's services, we serve children, families, and actually general mental health. And then our adult services, we serve our SMI adults, so seriously mentally ill adults. A big workforce we're looking for right now are case managers, and it's very similar to everyone else, just because they're the ones that help coordinate care and really work with our members, as they're going through their recovery in their life. Another area that we're looking to recruit for is our ACT team as well. Mostly for our ACT is just in the East Valley. I have an ACT housing specialist as well as an ACT substance abuse specialist. ACT is tricky because it is, community-based work, and we want to look for experience, especially people who have worked with seriously mentally ill adults. And I know it's, everyone's a little hesitant right now to like go out in the community. It's just the work itself, and we want to be able to do that outreach. Other positions that people may not know about is we do have office assistants in our locations. I actually have 5 clinics looking for office assistants. It's a really great opportunity, especially for those who don't meet a BHT criteria for those other positions like case management or like supportive roles. So that's a really great way to still be able to interact and gain experience to be able to work your way, towards those other types of positions. Other harder level positions, I'm looking for psychiatrists on our children's services as well as our adult services. So we have 1 for each. And then we are also looking for a site administrator for our Northern Star Clinic, which is located in the Phoenix area. This position, of course, is a leadership role that works with the clinical director to help oversee, and making sure that that Northern Star Clinic is running smoothly, and being a support to everyone in the clinic. So very similar to everyone else with our needs. Our clinics, we're open Monday through Friday, 7 a.m. to 6 p.m. So typically, more traditional schedule. The position for ACT, some of the roles do help cover like a weekend day. So for example, some teams will have it where someone works like Tuesday through Saturday, regular schedule. So to help, with that, especially, for the needs of the member. So yeah, that's kind of a challenge sometimes, but most of our positions are Monday through Friday.
Awesome. Thank you for that. Jose let me know that he's got some really good questions for everyone here, for all the panelists. He's intimately familiar with your role and the positions you're looking for. So he had some more specific questions. So I'm going to turn this over to Jose and let him ask the next round.
All right. Thank you, Ryan.
Yeah.
So a couple of questions were popping in my head as you guys were speaking. So I want you guys, if you can expand on some of the peer support positions you're seeking and talk a little bit about what those roles are like and what you're seeking.
All right, Jose, you pick someone. Who goes first?
All right. Let's go with LifeWell. Kara, let's talk about residential. What are you seeking for peer support?
Absolutely. We have multiple peer support positions open right now in our community living programs, in our transitional living. So there's a couple of different positions. Not everything's open right at the moment, but I know we have some in transitional living to work in that program, which is a short-term 30-day program for people with that semi-diagnosis. To assist them in building skills to move on to their next housing or next treatment or whatever that looks like. So that's, on site with people who live right there. A lot of really good experience working with the members, a lot of opportunity to really get in there and help. We have float peer supports that go among our different sites with our flex care sites. As well, that's a really good opportunity to work with a whole bunch of different people in different programs. We have floats in our residential program, our BHRF level peer support floats that go around all our residential sites and can do things individually with members at that peer level, assist them in going to apply for benefits, things like that, as well out in the community, support them at appointments, are all things that our peer supports would do. So it's a lot of good experience and it's a really good ability to help people.
Awesome, thank you. What about Valleywise? Vicki, do you guys have any peer support positions?
We do currently have one peer support position at our Mesa Behavioral Health Specialty Clinic. We were actually really excited because our peer support there went to our ACT team and really wanted to have that more intensive engagement with members. So it was a nice opportunity. So we do have that position available now. But look under team specialist because it'll say team specialist peer support. So again, we have kind of that equal for all of our team specialists, housing, employment, rehab, peer support, all of that. And then you have your specialty because we kind of think of it as like you're a team specialist, but then you also have a specialty area that you focus on.
Awesome.
So
thank you so
with
much.
the peer support, and I think, peer support as always can be a challenge in finding the right person that really that a lot of peer support positions maybe aren't as community based. And so it's a great opportunity for people who want to get much more into the community, working with people in their homes, working with people where they work, different things like that. So
awesome. Thank you. What about Southwest Network? Do you guys have any peer support positions available?
We do. So I have 3 available within the organization. So it's not going to be titled peer support specialist. You will see recovery coach or recovery specialist. So we do look for that peer support certification. A couple barriers, just, FYI for like just more information. We don't unfortunately like hire individuals who receive services with us, because I know like that personal experience we do look for. We just can't look at individuals. We want to make sure there's a separation, especially with conflict of interest. Another thing is driving requirements. So for our roles, we do have driving requirements, and I know that driving can be a barrier for individuals if they don't have their own transportation. But we are definitely looking, and we just require peer support certification, and the ability to drive for work.
Awesome. That's really helpful information. Thank you for that. CPLC, any peer support positions?
We do employ peers, but we don't actually have any openings right now.
Okay. All right. Florence Crittenden, do you have any positions for peer supports?
We don't have anything necessarily for peer supports, though many of our BHT staff have been in the peer situation before. And so they've been a huge asset to our community, a huge support to our girls. So the BHT positions, it does require, similar to the other things that we've heard, having the high school diploma or GED. And as far as the experience goes, it can vary just as long as they're experienced with youth. We can kind of go from there, and we are willing to help train if there's not much experience with it. We can absolutely do that, and are always looking for opportunities for others to grow within the organization, especially as we work with CPLC. There's a huge amount of growth and opportunity as a whole. So that's kind of the extent to what our peer supports have been.
Awesome. Thank you. Intermountain Center, how are you? And do you have any peer support positions available?
We do. We have one opening in Phoenix currently, very similar qualifications to what Southwest was mentioning. We do require the peer support certification. I know there are some circumstances if you're currently enrolled in the course, we may offer employment, but it's all case by case. But we do have the one opening.
Okay, thank you. Another question that has come up with job seekers is the issue regarding a fingerprints clearance card. Do your organizations assist an individual financially in obtaining a fingerprint clearance card or reimburse? And we'll start with LifeWell, because I think they answered that question in the chat. We'll go with LifeWell and then we'll go around.
Yes, we do reimburse individuals and applicants with the cost of the fingerprint clearance card on their first paycheck. So they will have to start employment in order to be reimbursed a cost for the printing and the related background check with that. Not all of our positions do require a fingerprint clearance card, but a lot of our positions do.
Thank you. Southwest Network.
We also help, we'll help you obtain one. We usually do a reimbursement. For those individuals who can't pay for it upfront, we have ways to be able to do that to help. All of our positions don't require it. It's only for our children's services side. So adult services, we don't.
Okay, CPLC.
We don't actually require it. So
okay.
If at least not at Esperanza, the SMI clinic. I am unsure about Corazon. I don't believe that they require it, but if a program does require it, we will assist in the reimbursement.
All right. What about Valleywise?
Some of our positions require it and some of them don't. Unfortunately, for the positions that are required, they are expected to have that in place prior to obtaining the job. It's part of the basic requirements. So we would not reimburse for that.
All right. Florence Crittenden?
We will cover the cost for a fingerprint clearance card if someone doesn't have that.
Okay. What about Intermountain?
So all of our positions do require the fingerprint clearance card. We do not reimburse for the initial card. It is an expectation of employment. But renewals for existing employees, we will reimburse.
All right. Okay, another question that I've been asked several times Are there any hybrid models of work where people have the opportunity to work a little bit from home and member-facing opportunities at the sites, and also flexible scheduling? For example, are 410s, not the standard 9 to 5 or 8 to 6 kind of thing? So we'll go with Intermountain. We'll start with you, and if you can answer that question, that would be awesome.
We don't currently have any positions that have a hybrid model like that. They are all in person. We've stayed in person through COVID, and we're planning to remain that way.
And as far as flex schedules, or, that's on an individual basis, that's determined at the site and the program level between the employee and their manager.
Right, thank you for that. Florence Crittenden, how about you?
As all of our services are in person, we don't have anything that's hybrid right now. All of our therapists would be in person. We are working to see if there's an opportunity to have our therapist position be a little bit more flexible, some 410s. It really depends on making sure that everyone's still able to meet the needs of our clients, but it's something that we're open to and currently exploring.
CPLC, Jennifer?
Yeah, so our nurses at the SMI site have the opportunity to work either 310s or 410s. And CPLC, I don't know if this is true of other companies, but I know CPLC honors 30 hours as full-time for benefits. So even if someone is only working 30 hours, they can still get benefits. And then the case managers work a standard Monday through Friday, 8 to 5 schedule. And they are, most case managers are working a hybrid model. So they spend a little over 50% of their time in the clinic, and then they get the opportunity to continue to work from home to do their administrative duties. And we do plan, like, even, when restrictions maybe are completely unnecessary, we have found that case managers, at least most of them, I'd say 95% of them, have done really well working from home. And so that is something that we would like to continue. Even if it's just one day a week that they get to do, like, their, they get to do one day at home to do administrative duties. So.
Awesome, thank you. Valleywise.
It's kind of a mix. It really depends on the position in the program. Like, for example, our ACT teams all work 410 schedules. So they have that flexible. I know our First Episode Center and our Mesa Clinic, they do a hybrid model where there's some in-clinic days and then some out days. And so we really work based on the needs of the program and also the needs of the individual. So we have some individuals who don't want to work a flex schedule and like to be in the office. And we have others that really like that flexibility. Our integrated behavioral health clinicians that work in our FQHCs do a hybrid model as well. And so they have some in clinic days and some work at home days and doing telemed. So I think with COVID, it stretched us all to be creative and unique and figure out different ways to both help our workforce, but also improve access for our members so that, with the telehealth advances, people are able to work more flexible schedules and that. So we try to, we don't have any kind of standard rules across the board. We also have the, if people have, a part-time schedule that, I believe ours is 30 hours also for benefits. So.
All right.
Hopefully I answered that. So it's kind of depends on the job, on the program, on the position.
All right, Southwest Network.
So nothing official that I know of right now for a hybrid model. I know throughout the pandemic, we did transition a lot of staff to work from home. I know there's conversations, but I can't give a definite of what that looks like. I know as far as like having a 410 schedule, the only positions that we can offer that are for our nurses, nurse practitioners, and psychiatrists. Every other position works typically Monday through Friday.
Thank you. LifeWell.
I'll echo what Vicki said. It really depends on the program and on the position. In the residential treatment side, we have to be there. There's no way that people can work from home and the members are by themselves on the side, so that's not going to work. But then in Jared's program and Michelle's programs, more of the outpatient services, we do allow flexibility, and it depends on on various different things. The staffing levels. If we're not fully staffed, we can't have people work 4/10s and then there's a day in the week where nobody's in the office. So it definitely depends on staffing levels and also again on the position. For example, the front desk receptionist is probably likely not able to work from home, but the therapist can do telehealth appointments from a remote location. So I don't know if Michelle or Jared want to chime in.
Sure. I have some points that I want to follow up with. Just circling back to the peer support roles, Kara already talked about the peer support roles in her programs and the residential programs, but we also have peer support roles in our outpatient programs as well. We're actually needing to hire 3 peer supports for all of our outpatient hubs, 2 in East Valley and 1 in the West Valley in downtown Phoenix at the Mitchell location. So we do have those positions that we're needing to fill, and those positions really they focus a lot on the peer using their shared experience, right, with helping the members and adding that more personal aspect to the services they're receiving and supporting them in their recovery and in their mental health. So we are looking to hire for those positions. I'm also looking to hire for 2. I'm the regional manager of the Central West region, so the downtown Phoenix and then our Desert Cove location, which is like Peoria and 23rd Avenue, I think. So look to hire 2 program coordinators there. That is a licensed position at the associate level. The lowest license that it qualifies is the associate level license for that position. Looking to hire 2 of those positions. That, to answer your question, those are probably difficult positions to hire for because of the licensure requirement. And then to answer the actual question that you asked about the flex schedules, we do have flex schedule availability within our outpatient programs. So that is something that is a newer perk that we are doing since COVID, and it has been quite successful. So I'm hopeful that it will continue. But yes, I hope that answered the question.
And here at the direct care clinics, the integrated direct care clinics for LifeWell, where we work to inspire hope, support better health, and provide opportunities for healing, we do offer flexible scheduling options for our case management staff, our nurse practitioners, our nursing staff. As Alexandra identified, it depends on the site and the needs of the site, but we do offer that flexibility. We are open on Monday through Friday. And so we also offer for our case management staff who aren't working 4/10s, who are working 5 days a week, the ability to work from home 1 to 2 times a week on administrative stuff and being able and available to do community activities with our members while they're already in the community. And so we do offer some flexibility in that as well. And we are certainly hiring for what many of you have already described, our case management roles, our peer support specialist roles, our family mentor roles, rehab specialist roles throughout the direct care integrated clinics as well.
Thank you for that. One question that came up from the panel that I want to address is, can one be a BHT without experience, but have a peer support certification and have been in the system for a long time?
What does been in the system refer to? A member or have been working in the system?
That's a great clarification point. I'm assuming from reading this, and please, whoever asked this question, correct me if I'm wrong in the chat, but I'm assuming has been a part of the system for a long time and might not have the direct work experience, but has the certification and been part of the system. Let me see. Yes, being a member of the system. They clarified.
So for the peer support specialist roles, they don't need to be BHT eligible. So at LifeWell, I speak of LifeWell, obviously. So for LifeWell, the peer support position is not a BHT level position. So the only requirement for the peer supports is that they have the completed peer support certification, which we also offer at LifeWell, just FYI. We offer that class. So that's really the only requirement, educational wise. Of course, there's the driving record and the criminal background check, of course, as well. But for the BHT level positions, we do look at actual work experience. If they have high school diploma or GED, they have to have paid work experience for at least 3 years. And that's a licensure requirement for most of our sites.
All right. What about any other organizations want to chime in?
At Valleywise, our peer support specialists are considered team specialists and must meet the requirements for BHTs.
Okay.
And so that way it's in kind of an equal salary range across the areas as well. So they do need to have that experience and qualify as a BHT as well as a peer.
Jennifer, I think you wanted to say something. Do you want to chime in?
Well, I was just going to add that we have hired people in case management / BHT roles that didn't have a lot of experience working in the field. So the person would just have to have some applicable job experience, basically to like customer service, and just be able to show that they have worked in a setting where they have to deal with the public, deal with customers or just people, and we would consider them, I might get this wrong, but it wouldn't be a BHT, it would be a BHPP, a paraprofessional.
Yes.
So then we would just have like a supervisor, someone in like a leadership role, kind of not audit, but review their notes until they qualify for the BHT role, and then they could be considered BHTs. So we will accept people who are maybe not totally qualified for BHT, but they'll just have to have a little bit higher level supervision while they gain that experience.
All right. All right, Ryan, I'm going to give you the ball back so you can continue on your questions. Thanks so much.
To ask. So I'm going to ask one of my favorite questions now, since we have everybody here. For me, it sounds like you're looking for similar roles, similar experience, similar licenses. So for those community partners and job seekers that are on the call or watching the recording, what makes you different? Why apply with one company versus another? And a lot of times I fully subscribe to the idea that people want to work for a team that they're excited to go work with. They want to work for a company that they feel is making a difference in the community, which it sounds like to me everybody here is doing. But really, what makes you different? Why pick one of you over someone else? Don't be mean, but this is a chance for you to just say, hey, these are the things you're not going to see when you go to our website and see our job descriptions. Maybe it's a culture, maybe it's the way you guys do leadership, maybe there's some additional benefits, the type of people you hire. It's entirely up to you how you want to answer that question, but what makes you different? Why should someone come apply there? What are the things they're not going to find out by going to looking at one of your job posts? So we'll start with Southwest Network.
That's a really great question. I have to say that. And my mind is like, trying to think of everything. I think for us, I think it's mostly like the company culture that we're really trying to like cultivate. We want to make sure, because this field is so hard, you need a team and you need to be able to have that support. And we see that a lot of when people are looking for jobs with us is like, I'm looking for a team, I'm looking for support. It can get really overwhelming. So we're really trying to do that. Like we have pillars and we always like try to do nominations within like each of our locations. If someone does like an amazing job, we want to focus on that. But also like we like, being in HR and we look at our retention, we have a lot of staff that have worked here over 10 years, a lot of case managers. And it's like, we've been doing these stay interviews to figure out, hey, like what's making you stay with us? Like, what are we doing right? So we're always trying to ask the questions of like, how can we, cultivate this, how can we also promote growth? And we really try to do that. One thing is like one of our benefits is tuition reimbursement. We see a lot of our staff who are case managers and now they're wanting to become therapists. So then they go back to school to get like their master's in like social work or counseling. And then, you know, we give the opportunity for individuals based on like what's available to get like supervision for licensure. It's never guaranteed, but it is something we work with all of our locations and see like, you know, our independently licensed individuals to help and support with that. So it's more the connection, you know, we want all of our locations and we want to feel as like a whole unit, even though it's hard because everyone's like out in the field or at different locations, to really create that kind of culture.
Thank you. Valleywise.
I think for us, the culture is really important. I think one of the things that makes us unique is really we want to keep people have a lifelong career. And I know for a lot of people, they move around a lot. We really want to get people and have people stay with us. I think about like many of our psychiatrists that work in our clinics actually did their residency here. Several of them were case managers in the behavioral health system, then went on to do their residency, and then now are the team psychiatrists. We have really great benefits. We're kind of weird because we're what's called a quasi-government. So we actually participate in the Arizona state retirement system, which I don't think people realize a lot of times. So we do participate in that. We have great healthcare, great benefits, but we also have great opportunity, within our system and a lot of diversity. So people can try out positions and then hopefully if that's not a good fit, they can look for another position with the organization. And so we want to keep that energy and keep those individuals with us. We have many of our team specialists and MAs right now that work on our outpatient clinics that are going to nursing school. And we do provide, support for people who want to continue their education and continue their growth within the company. And so I think that makes us not unique because I know a lot of my colleagues offer all sorts of opportunities. And I think all of us want people to stay with us. It's in it, we invest in you and you invest in us. And so we want that to continue on. But I also think, for anyone, we want people to promote and grow within the company and or within other organizations. I think right now we all want to keep people in behavioral health. We want to make sure that people have that opportunity to grow. So I think that's it. I think the culture of engagement, I think we've been the public safety net system for Maricopa County I probably will get this wrong and forgive me for the recording if anybody from Valleywise watches this. I think it's like, I want to say like the, cart and buggy days, but it was like way back, hundreds of years ago. We started as the county safety net system and have continued to grow. So we have a lot of longevity and a lot of history in providing healthcare in the Valley.
All right, thank you. Intermountain.
Thanks. Hi, guys. So I think one of the things, there are several things that set Intermountain apart. One of them that I'm really impressed with is we have an incredibly vast array of services. So we are statewide. We exist in every county within Arizona. We do everything from integrated healthcare. We have an autism academy. We have foster care services, residential programs, inpatient, outpatient, the whole gamut. So one of the attractive things is there is a lot of movement. So as everyone's discussing and pathways to promotion and obtaining licensure, we've developed programs for people to obtain their licenses and get supervision requirements through us. We also have developed a leadership academy. We look for emerging leaders. We look for our really strong informal leaders and how we can promote them up and grow and develop people. So when we see people that have exceptional performance, we like to put them on a year-long track to be promotable and know the supervisory, both the soft skills and the tactical skills that are required to promote up within the organization. We also have several student loan reimbursement and tuition reimbursement programs, licensure reimbursement programs, things of that nature, as well as all of the standard, health benefits and things of that nature that come with industry standard. So yeah, there's a lot of possibility for movement. If you have a spouse or partner that has a job that they have to move to a different city, chances are we're there. You can join us. So thanks for that.
All right, thank you.
Excuse me, Ryan.
Yeah.
I just want to chime in real quick. I just want to draw the panelists' attention to the comment from Sherry. Sherry does registered apprenticeships throughout the Valley, for example, with electricians, HVAC, plumbing, and helps folks get connected in a way to move folks in that direction of work. So if you're interested, she is a wonderful resource to connect with to possibly start apprenticeship programs for your positions that are being difficult to fill, and get people interested in those fields of work and help you connect. And they also have apprenticeships for behavioral health techs too. So I would definitely advise you, her email is there. Make that connection to Sherry. She speaks for us at NEPA as well. We've had her speak. We are always looking to build community. She is a great connection to potentially build a BHT apprenticeship program with your organizations and really help you fill positions. So please connect with her. Sorry, go ahead, Ryan.
No worries. All right, CPLC.
Okay, so a lot of what other panelists have stated is also true at Esperanza, at CPLC in general. CPLC was started a very long time ago, and it was a grassroots organ. I guess they weren't an organization yet, but mission. So they started working in the community, help improving labor laws and working with people who are less fortunate. And that has been like the thread that has made CPLC grow. So CPLC has a lot of different lines of business across multiple states. So I would say that what kind of sets us apart is that we're not just behavioral health or healthcare. We have a lot of different lines of business that while you work for us, you can learn about. And if you'll be educated on all the different lines of business that we have throughout your employment. And if anything ever jumps out at you is like you want to learn more or whatever, you have that opportunity. CPLC takes their cultural and cultural competency very seriously, and not that other agencies don't, but it's just our roots. Our roots have always been helping the less fortunate. So another thing I'd like to mention at Esperanza is that we have, and I don't say this in a mean way, but we have a very low tolerance for people who are not therapeutic or recovery focused, and then also who are not creating like a positive work environment and contributing to morale. So I would say that should be true of all sites, of course, but that's something that I take very seriously as the program director. And then also, just another thing that sets us aside that I'm not sure other people have mentioned, but I have worked for other providers and agencies, none of which are on this call. But I would say that a lot of the places that I've worked, pay increases linked to performance evaluations didn't exist in my previous places of employment, but CPLC has a company-wide policy, company-wide for all 2,000 of our employees. That you are assessed on a minimum of annual basis of your performance. And when you get your annual performance evaluation, you do qualify for a 1 to 3% increase. And it is based on your performance. So if you're performing really well and you're meeting all your expectations, then you're pretty much guaranteed a 3% raise every year. We have great benefits. We do have tuition reimbursement. It's not like a ton. We're not going to pay for your education, but we can reimburse at least part of it. CPLC, because of certain lines of business, they're not considered a not-for-profit agency as far as like 401ks versus 403bs. So although the pillar that we work under is considered nonprofit, the agency or the company as a whole is not considered nonprofit. And so we have 401ks, And the matching rate that CPLC gives is good. So I think that's all I really wanted to mention. And I would really like to mention this as well, is that because CPLC is so diverse in their lines of business, and Esperanza is their only SMI clinic, our GMH site is their only GMH clinic. You know, we're not a company that's based in behavioral health. And so our leadership, there's multiple pillars within CPLC, but the pillar that we fall under, the leadership that's just above me, is very active in the clinic. They're very in touch with what's going on. I feel very well supported on a daily basis. And so I think that that's also worth mentioning, because I'm just going to say it, other agencies, I know that having an executive team that is a little far removed from the day-to-day in the clinic can cause challenges, and to have people, especially in leadership positions, feel unsupported. And so that's something I really value about CPLC, is that my bosses are very much in touch with what's going on at my clinic while they're also managing other things. So I just thought I'd mention that as well.
All right. Thank you, Jennifer. Florence Crittenton, anything to add? Anything different?
Yeah, so I would just kind of piggyback off of what everyone has already said. It's our people. We love our people. We love our staff. Our staff have reported how much they love their jobs, what we do. We did just do an internal survey at Florence Crittenton, and we had very great feedback from staff who are here, very mission focused, reporting that they love their coworkers, they love what they do, and they enjoy coming to work. And I think that's really what all of us are here for in the first place, is to love our jobs, love what we do, and make that impact in the community. And we've had staff say, a very high amount of our staff have reported that that's exactly what they feel here. So that's, I guess, not different from other people, but something that is very important to us. And we take it very seriously. So.
All right, thank you. And then LifeWell.
I could start with some of the HR related things, but then I would like to hear from our supervisors too, what they can offer as well. So we are one of the bigger nonprofits, I think, here in behavioral health, but it still feels we still have that family environment. I think that sets us apart. Our leadership team is very, very approachable. And we also offer a ton of internal opportunities for promotion. Most of our leadership team has been promoted from within. So if you similar to what Vicki said, we invest in you, you invest in us. If you, stick around and there will be promotional opportunities available for you for sure. We also have a very unique health insurance module. We are on a private exchange. I'm not going to get into a lot of detail, but how we look at health insurance is we give you money and you go shopping for your insurance. It's like on Amazon. You pick and choose what you want. We have about 15 different medical plans just to choose from. So it's not, we offer these two plans and either you take it or you don't. You get your funds from us, your money from LifeWell, and then you go shopping for the insurance that you actually truly need. It's not like you get your medical and your dental, and if you want something else and we don't offer it, then you're out of luck. So that's a very unique benefit for sure. And last but not least, and then I take it over to our supervisors, we do currently offer recovery pay. So that's additional $3 an hour for every clinical team member, sort of an appreciation that they have been so amazing during this pandemic. And as a community, as an organization, we need to all recover from whatever happened. And so as an appreciation, we do currently pay additional $3 an hour.
I agree. This is Michelle from LifeWell. I agree with Alexandra's statements that we certainly invest in people. Many of our employees have worked their way up from case manager to upper management positions. We do have a very tight-knit family culture with LifeWell, although we across the DCC clinics, there are 4 in the Valley. We are all very close-knit. Maintaining contact almost daily. Our management and leadership teams and supervisory staff are in our clinics, available throughout weeks. are available through email, phone calls. Our HR and supportive teams in management are very, very supportive as well, and can be reached readily, are readily available to all staff across all disciplines. We pride ourselves on building people, and that includes our staff. And so we provide opportunities for our staff to be creative, to offer creative solutions, to problem solve situations in terms of member care, quality of care, service delivery provision, and our teams, we pride our teams on their ability to be able to do that within the team structure, accompanied by our nurse practitioners and our medical support staff. Here at LifeWell, we're just one big family. We have lots of clinical teams, but the sites themselves are supportive across the DCC clinics. I'm the site administrator at South Mountain. However, any one of the other site administrators are welcome and are present and can be present at the drop of a hat or a phone call in any of the other locations, as well as our clinical directors. And so there is this sense of family, LifeWell being a very supportive, caring family that wants to hear from all of the entities, the disciplines across LifeWell to support our staff in the positions they're in, to help them grow, to be successful, as well as to provide supportive services and growth opportunities for our members as well.
Thank you for that. I'm going to move to one last quick question for everybody. We've only got a few minutes left, and I want to be aware of everybody's time. One of the questions that I get asked a lot I hear from job seekers mostly is, if I apply, when am I going to hear from you? Or am I going to hear from you? And how long does it take after I apply to get an interview? So I'd like to go through each one of you real quick, less than a minute. If you could just let me know, what's the turnaround time for responding to applicants, whether they get we're going to move forward or not, and how long from when they apply to when they'll get an interview. So I'll start with LifeWell on that, and then we're going to wrap. So if there's anything else that you want to say, now's the time to do it.
Okay, thank you. So we are daily looking at resumes every single day. Our goal is to get back with applicants within 2 to 3 days at a minimum, and so, or at a maximum, I guess. If you don't hear back from us, you can always feel free to give us a call. A lot of times, I've seen that on like job boards like Indeed or ZipRecruiter, when people upload a resume, sometimes it's jumbled, that the phone number doesn't really show, or there is not a contact email attached on the resume. So I guess when I'm talking to you as job seekers, just also make sure that you have current contact information included on the resume. That's something that we're running into a lot, where phone numbers don't work or, out of service. And then also what we're running into a lot is we're leaving messages and we don't hear back. It's a two-way street for sure. But again, if you have applied and you don't hear back, feel free to pick up the phone and give us a ring, and we're happy to talk.
Thank you. CPLC.
I'm sorry, what was the question again?
Turnaround time for responding to applicants, and how long to get an interview.
So as soon as you apply, the hiring manager gets an alert. We have a lot of vacancies, so turnaround right now is pretty quick. So if you apply, you should be getting a phone call within a couple of days. And then based on your availability and our availability, we can get an interview scheduled pretty quickly. And then if we do decide to hire you, it's kind of based on the amount of interviews we're doing, because we obviously want to interview as many people as possible. But I would say that there's probably like a 3 to 4 week turnaround on apply and start. So that includes like the interview, the background, all those things. So I would say it takes about 3 to 4 weeks from date of applicant to date of start.
Okay, thank you. Florence Crittenton, is about the same for you?
As soon as we are checking them daily as well. So as soon as those come in, we will set up a call. We generally do a phone screen first. So that will be the first step of the interview process. And then it will be an in-person interview after that. And then I have my contact information in the chat. So if you guys contact me directly, I can guarantee you I will be in touch within 24 hours.
Awesome. Thank you. Intermountain.
So we process applications daily, forwarded to the hiring manager, and then they actually set up interviews themselves, each department hiring manager. But generally, like Jennifer mentioned, it's just based on their schedule and the applicant's availability. But we're also on a similar timeline from application to interview to start is about 3 weeks. We do new hire orientation every other week currently, but another step that can delay the process is not having the fingerprint clearance card. So it's kind of contingent on those pre-employment items, but we're generally processing applications daily and managers are reaching out within a few days.
All right, thank you. Valleywise.
I get very similar to everyone else. I know on our website, we have a whole flow chart and you can like check your application. And so there's a way to online to check the application. And so typically, you know, once the completed application and just so folks know, you have to submit your application online at Valleywise. That's the only way you can apply. So just so folks know, everything is all done online and then the recruiter will call and then they'll set up the interviews with the department manager and sometimes it goes really fast and then you know like other people have said sometimes it can go slow if we're waiting on documents or materials or verifications, that type of thing, but usually it goes fairly quickly because we want to get folks in, you know, we want to get we know you don't want to wait and we don't want you to wait, we want you to get in. We have a new hire orientation, of course, like everyone else does. Most of that's online now, which is really nice. And so it's kind of sped up that orientation process so we can get people to work right away. So
Fantastic. And Southwest Network. You're muted.
Oh, here we go. So we're very similar to everyone else. You know, I check applications every single day. Usually you'll get, you know, we'll have someone call to schedule a phone screen. There's always that first because we want to make sure whatever position you apply for, you qualify, and we can look at other opportunities too. From there, then we set up interviews at their sites and then start the process. So typically it can anywhere from like 3 weeks from application to start. We have new employee orientation every other week as well.
All right, thank you. And I just want to thank all of our panelists today. A lot of great information. A lot of information, so many positions open, so many opportunities. So for those community partners that are listening or any job seekers, make sure to check out these open positions. You not only got to hear about the work that's available, but also what it's like to be a part of their team, which I know sometimes is really difficult to find, especially when you're in the hurry of looking for new work. So, you know, just make sure that you're applying for a position with a company that you want to be a part of. One piece of advice I'll give to job seekers or community partners listening, because I hear this all the time from our panelists, make sure you know a little bit about the position you're applying for, the company you're applying with. Make sure that you know a little bit going into it. It'll definitely help your odds during the interview process. So again, thank you so much for being here. I'm going to turn this over to Jose and he's going to wrap us up.
All right, thank you so much for all that valuable information. So what I want to go through is some resources for job seekers and employers. You can contact Vera Lee, who's with Arizona at Work. So just a little bit about Arizona at Work. Arizona at Work is also run by the City of Phoenix as well as the County of Maricopa County. And that is a great resource for individuals seeking employment who may not have the resources at home to do job search. You can go there, use their computers, create your resume, print your resume, make phone calls, and they also offer workshops around building a resume, career exploration, etc. And they also have a great job board called Arizona Job Connections, and all their jobs get filtered through there so you can see what's available in the Valley. And I would also encourage the organizations that connected with us today to reach out to Vera Lee because she can get your job postings posted on the Arizona Job Connections as well. All right. Arizona at Work, they also have expanded virtual employment academy. This is something new that they're offering. You can submit a job seeker inquiry form at maricopa.gov, find a job, select virtual employment academy, and you can do 3 separate 3-hour modules, modules A, B, C, and D. And it is a 4-part online workshop that's going to help you sharpen your employability skills and help you prepare for an effective job search. So if any of you job seekers are feeling a little rusty or you haven't been working for a while, that might be a great opportunity for you to sharpen up those skills. This is a great way to get some job blasts. Just text AZ at Work to 22828 and you'll get a text back that'll ask you for your email address and you'll get job blasts. I signed up for this. They send a spreadsheet of about 5,000 jobs. You can filter it by county, types of jobs, etc., to find something. And also the community partners, we have Arizona Retail Careers, Best Companies in AZ, Career Connectors, Chicanos por la Casa, Goodwill, Job Advertising, Local Work, and Pipeline AZ are also other resources that you can utilize. All right, let's talk about August. We have a great speaker coming up. Oh, what? This is a different slide. Never mind. We have a West Valley Industry Spotlight Forum. You can register at westmark.pipelineaz.com, and you can hear from industry career experts on the upcoming events.
Here's the one you're waiting for.
This is the one I'm waiting for. All right. So our NEPTA meeting next month is on August 20th. And we're going to have Hillary Keene speak, and she is going to do a great presentation. She did this presentation for the Mercy Care Connections Conference about how to build your network, how to use the social media to help build your network, how to build your network, because a lot of the jobs sometimes don't get posted, and sometimes it's about who you know, who you connect with, who's within your network. This is a great opportunity for job seekers as well as people who are employed to learn how to build the network. So she will be speaking on August 20th at 10 a.m. If you're interested, you have to go to our NEPTA AZ website, register, and you'll get the link to attend the meeting. And that's going to wrap us up for this meeting. And again, thank you so much. And please, I encourage you, please connect with Sherry for an apprenticeship opportunity. I think that was going to be very helpful to helping you fill some of your positions as well. And thank you all for your time and have a great weekend, everyone. Thank you.
Thank you. Bye.
Thank you.
Thank you.
This is great. Thanks.